This is the masseter bone. Its origin is at the zygomatic arch. It has two insertions, one at the ramus of the mandible and one at the coronoid process, and it has three main actions. It elevates and protrudes the mandible, and the deeper fibers of the muscle retract it. This is the temporalis. Its main actions are to elevate the mandible, and the posterior fibers of the temporalis retract the mandible. This is the occipitofrontalis muscle. This muscle has two main parts, the frontal belly and the occipital belly. The main action of the frontal belly is to elevate the eyebrows, and the main action of the occipital belly is to move the scalp backwards. This is the orbicularis oculi. Its main action is to close the eyelids. This is the orbicularis oris. Its main actions are to compress, contract, and protrude the lips. This is the sternocleidomastoid. It has two origins. One is known as the sternal head, which is at the anterior surface of the manubrium of the sternum, and one is the clavicular head, or the upper surface of the medial one-third of the clavicle. It also has two insertions, one on the lateral surface of the mastoid process, and another on the lateral half of the superior nuchal line of the occipital bone. It has several actions. Bilaterally, it flexes the head and elevates the thorax. Unilaterally, it turns the face towards the opposite side. This is the pectoralis major. It has four origins, one on the sternal half of the clavicle, another from the sternum to the seventh rib, the cartilages of the true ribs, and the aponeurosis of the external abdominal oblique muscle. Its insertion is at the intertubercular groove of the humerus. Its main actions are to flex, adduct, and medially rotate the arms. This is the rectus abdominis. Its origins are at the pubic symphysis and pubic crest. Its insertions are at the xiphoid process and the costal cartilage of ribs 5 through 7. Its main actions are to flex the trunk and compress the abdominal viscera. This is the external oblique. Its main actions are to compress and support the abdominal viscera and flex and rotate the trunk. This is the pectoralis minor. Its main actions are to depress the scapula and protract the scapula. This is the serratus anterior muscle. Its main actions are to protract, rotate, and hold the scapula against the thoracic wall. This is the external intercostal. Its main actions are to support the intercostal spaces during inspiration and expiration, and to elevate the ribs during inspiration. This is the internal intercostal. Its main actions are to prevent the pushing out or drawing in of the intercostal spaces during inspiration and expiration, and it also depresses the ribs during forced expiration. This is the diaphragm. Its main action is to draw the central tendon down and forward during inspiration. This is the transversus abdominis. Its main action is to compress and support the abdominal viscera. This is the internal oblique. Its main actions are to compress and support the abdominal viscera and to flex and rotate the trunk. This is the external oblique. Its main actions are to compress and support the abdominal viscera and flex and rotate the trunk. The biceps brachii has two heads, the long head and the short head. The origin of the long head is at the supraglenoid tubercle of the scapula, and the origin of the short head is at the coracoid process of the scapula. It has two insertion points, one at the radial tuberosity and one in the bicipital aponeurosis. Its main actions are to flex and supinate the forearm at the elbow. This is the coracobrachialis. Its main actions are to flex and adduct the arm at the shoulder. This is the brachialis. Its main action is to flex the forearm at the elbow. This is the subscapularis. Its main actions are to medially rotate and adduct the arm, and it also helps hold the humeral head in the glenoid fossa. This is the brachioradialis. Its main action is the weak flexion of the forearm when the forearm is mid-pronated. This is the pronator teres muscle. Its main actions are to pronate the forearm, and it also weakly flexes the elbow. This is the flexor carpi radialis. Its main actions are to flex and abduct the hand at the wrist. This is the palmaris longus. Its main actions are to flex the hand at the wrist and tense the palmar aponeurosis. This is the flexor carpi ulnaris muscle. Its main actions are to flex and adduct the hand at the wrist. The triceps brachii consists of 3 heads: the long head, the lateral head, and the medial head. The origin of the long head is at the infraglenoid tubercle of the scapula. The origin of the lateral head is at the upper half of the posterior humerus, and the origin of the medial head is at the distal 2/3 of the medial and posterior humerus. The main action of the triceps brachii are to extend the forearm at the elbow. The long head of the triceps brachii stabilizes the head of the abducted humerus and extends and adducts the arm. The flexor digitorum consists of 2 separate muscles, the flexor digitorum profundus and the flexor digitorum superficialis. The main actions of the flexor digitorum profundus are to flex the distal phalanges of the medial 4 digits and assist with the flexion of the hand at the wrist. The main actions of the flexor digitorum superficialis muscle is to flex the middle and proximal phalanges of the 4 medial digits and flex the hand at the wrist. This is the extensor carpi radialis longus. Its main action is to extend and abduct the hand at the wrist. This is the extensor carpi ulnaris. Its main actions are to extend and adduct the hand at the wrist. This is the extensor digitorum. Its main actions are to extend the medial 4 digits and to assist with wrist extension. This is the deltoid muscle. It has 3 origins, one on the lateral end of the clavicle, one on the acromion, and one on the spine of the scapula. Its insertion is at the deltoid tuberosity of the humerus. Its main actions are to flex and medially rotate the arm, abduct the arm, and extend and laterally rotate the arm. This is the trapezius. It has 4 origins, one at the superior nuchal line, one at the external occipital protuberance, the nuchal ligament, and the spinous processes of C7 through T12. Its insertions are at the lateral end of the clavicle, the acromion, and the spine of the scapula. Its main actions are to elevate, retract, and rotate the scapula, and the lower fibers of the trapezius depress the scapula. This is the latissimus dorsi. Its main actions are to extend, adduct, and medially rotate the humerus. This is the levator scapulae. Its main actions are to medially elevate the scapula and inferiorly rotate the glenoid fossa. This is the teres major. Its main action is to adduct and medially rotate the arm. This is the teres minor. Its main action is to laterally rotate the arm. This is the rhomboid major. Its origin is at the spinous processes of vertebrae T2 through T5. Its insertion is at the medial border of the scapula. The actions of the rhomboid major are to fix the scapula to the thoracic wall and to retract and rotate it to depress the glenoid cavity. This is the rhomboid minor. Its main actions are to fix the scapula to the thoracic wall and to retract and rotate the scapula in order to depress the glenoid cavity. This is the infraspinatus muscle. Its main action is to laterally rotate the arm. This is the supraspinatus muscle. Its origin is at the supraspinous fossa of the scapula and the deep fascia. Its insertion is at the greater tubercle of the humerus. Its main action is to initiate arm abduction. This is the erector spinae. It consists of 3 separate groups, the spinalis group, the longissimus group, and the iliocostalis group. Its main action is to extend and laterally bend the vertebral column and head. This is the gluteus maximus. It has 4 origins, one on the ilium, 2 on the dorsal surfaces of the sacrum and the coccyx, and one on the sacrotuberous ligament. Its insertions are at the lateral condyle of the tibia and the gluteal tuberosity of the femur. Its main actions are to extend the flexed thigh, assist in lateral rotation, and abduct the thigh. This is the gluteus medius. Its main actions are to abduct and medially rotate the thigh at the hips and to steady the pelvis on one leg when the other leg is raised. This is the rectus femoris, or the quadriceps. Its origin is at the anterior inferior iliac spine of the ilium, and its insertions are at the base of the patella and the tibial tuberosity. Its main actions are to extend the leg at the knee joint and to flex the thigh at the hip joint. This is the sartorius. Its main actions are to abduct, laterally rotate, and flex the thigh, and to flex the knee joint. This is the vastus lateralis, or the quadriceps. Its main action is to extend the leg at the knee joint. This is the vastus medialis, or the quadriceps. Its main action is to extend the leg at the knee joint. This is the gracilis. Its main actions are to adduct the thigh and to flex and medially rotate the leg. This is the adductor longus. Its origin is at the inferior body of the pubis, and its insertion is at the linea aspera of the femur. Its main action is to adduct the thigh at the hip. This is the adductor magnus. Its main actions are to adduct and flex the thigh, and to also extend the thigh. This is the iliopsoas, or the iliacus, and its main actions are to flex the thigh at the hips and to stabilize the hip joint. This is the pectineus. Its main actions are to adduct and flex the thigh at the hip. This is the semitendinosus. Its origin is at the ischial tuberosity, and its insertion is at the superior part of the medial surface of the tibia. Its main actions are to flex the leg and extend the thigh. This is the semimembranosus. Its origin is at the ischial tuberosity, and its insertion is at the medial condyle of the tibia. Its main actions are to flex the leg and extend the thigh. The gastrocnemius consists of two heads, the lateral head and the medial head. The origin of the lateral head is at the lateral condyle of the femur, and the origin of the medial head is at the medial condyle of the femur. Its insertion is at the calcaneus. Its main actions are to plantar flex the foot at the ankle joint and to assist in the flexion of the knee joint. This is the biceps femoris. Its main actions are to flex and laterally rotate the leg and extend the thigh at the hips. This is the tensor fasciae latae. Its origins are at the anterior superior iliac spine and the anterior part of the iliac crest. Its insertion is at the lateral condyle of the tibia. Its main actions are to abduct, medially rotate, and flex the thigh at the hips. It also helps to keep the knee extended. This is the soleus. Its main actions are to plantar flex the foot at the ankle and stabilize the leg over the foot. This is the tibialis anterior muscle. Its main actions are to dorsiflex the foot at the ankle and to invert the foot. This is the fibularis longus. Its main actions are to evert the foot and weakly plantar flex the foot at the ankle.